You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Welcome to the Expert Guide to Parenthood podcast. We are your hosts, Freya and Christy, also co-founders of Parents You've Got This.
This week we're going to be talking all about broken bones and childhood injuries. And I think as parents this is something we hope never happens, but unfortunately it happens all the time. So we have our Paediatric Orthopaedic surgeon Gary Nattrass on today to talk all about what happens if your child does break their bones.
Now, we're also talking about common childhood injuries, and it's sometimes so difficult, isn't it, Gary, to ascertain whether something after your child has hurt themselves, whether we need to do anything about it, whether it requires medical intervention. Can we talk first about some of those signs that maybe you do need to seek help rather than managing a bruise or a bump from home?
Well, Freya, there is no doubt it's hard enough, I can tell you, for a pediatric orthopedic surgeon to tell just looking at the child, and we always have the advantage of having the x-ray, so it makes it easier for us. And unless parents have x-ray vision, it is difficult. I think if you go back to basics, so if the injury has been witnessed, you can get a decent idea. If he's fallen off of monkey bars, like some families have quite a few kids do. I'm not looking at anybody.
Not naming any names, yes.
Well, you'd have a high suspicion that that's going to be a sinister injury. Whereas on the other hand, if they just sort of stumbled or tripped, even though they might have something, you would check them out, but probably be less worried than that trauma that we talked about. Oftentimes, so for parents, they don't witness it. All they hear is the scream.
Yes.
So then when you go see the child, first of all, you try to localize where it's hurting. And a good way to start with is upper extremities or the legs. And certainly if the child is not walking, one would assume it's in the legs. And then just narrow down. And if the child's old enough, they'll point where it hurts. If the child's not old enough, you need to be a bit of a detective, and that would be just, I think, gently prodding, palpating along the full length of the leg, and usually you do get a fairly good idea where it's at. If when you push on the soft tissues, or it's already seeing a bruise, and just the soft tissues are hurting, but you sort of get your fingers around the other way onto the bone, and the bone really is not bothering. Or if you stress the bone by holding, say, at the wrist, holding at the elbow, and then on the hand, and it's not hurting really when you stress, then you might feel more comfortable that it's not truly bony. At the end of it all, though, you have to trust your gut instinct. And if you have the gut instinct, something does not smell right here, just go get them checked. Nobody's going to call you silly for having your child checked out.
There's so many different injuries that little ones can have, aren't there, Gary? What are some of the common ones parents can expect their little one to receive during their childhood?
The one that's very common is the toddler fracture, which occurs in toddlers, usually any time from when they start cruising to that early walking, and probably up to about age 3. And classically that happens and they fall down a step. And often they'll still keep trying to walk, but they're crying when they walk. They usually hold their foot going outwards, just as sort of a walk of weakness, and then you palpate down and it hurts just above the ankle. Now this fracture is important not because they're going to get into trouble with it. If we did nothing, it's going to heal. But it is painful, and you want to make sure there's nothing else going on. So you'd push on the bone, it'd be sore, you'd get an x-ray, and then I would manage them in a plaster. Some people put them in little cam boots, and other people have said, just let them be. It is going to get better, and it will get better in a few weeks. The most common fractures, though, are the fractures around the wrist and then around the elbow, the supracondylar fractures. And the wrist fractures can be a complete fracture, but very common is a buckle fracture, where the bone just literally sort of buckles down a bit and you see a little bulge on the x-ray. Again, not important long term, but hurts, probably worth immobilizing. The other common type of fracture that kids get that adults don't get are what's called a green stick fracture. And that's where the bone just acts like an immature twig, and it will bend but not break. Those can be quite deformed and can need manipulation. The most important, though, fractures are what are called fractures that affect the growth plate. People often call them Salter-Harris fractures. Salter and Harris were two fantastic Canadian pediatric orthopedic surgeons who came up with the classification of the fracture. For the parent, it's not important, the classification. They just need to know if it's there, and that would be pain right around the joint, commonly at the ankle or at the wrist or at the elbow. Those, again, need x-ray, and often they don't need treated surgery, but they do need following along, because not only have they broken the bone, but sometimes they can injure the growth plate, which can have an effect long term.
Where is the growth plate?
So the growth plate is right next to the joint, and that's where the bone grows. So at the wrist, it would be just right here, and then you have at the elbow here. We also have it up in the shoulder, and the same idea in the lower leg, right above and below the knee, right above the elbow, the ankle, and these fractures again just need to be x-rayed.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
So Gary, if we're at the playground and we may not see, we may hear, that our little one has had a bad tumble and they're in a lot of pain, other than feeling around, are there any sort of signs that usually you might see if your child has broken a bone? I can think of a couple that I've experienced.
Well, I think you're probably the most experienced one in the room, having children with this fracture.
Well, no, but I was just like, I don't want to say usually, but with the 6 breaks that we've had, they've always been accompanied by nausea, grey, like the child just goes grey. Often, they might go in and out of consciousness a little bit. You can see that their body is really in shock. Is that normal, or what are some other sort of things that you start
going
see?
back to basics. If the alignment of the limb is no longer normal, if it doesn't look, if you can always look at the other side, if it's not the same,
if it looks okay, but
that's a good sign. But if it's not, that's definitely a bad sign. I think you can assume that a fracture is going to give a good deal of pain, but you can't say that a soft tissue injury won't. So for me, it doesn't necessarily help ruling out a soft tissue injury that parents could manage on their own. But I think if the type of reaction you have, personally, I would be having that child seen. The other thing is, are they using the extremity? So are they okay after having that early scream and cry? Actually, they'd like to walk over with their friends and they don't look that bad. Or, they're right-handed, but all of a sudden you bring out some candies and all they want to do is grab with the left hand. Again, you'd be thinking, we've got something more here.
So can you use your extremity if it is broken?
You can use it unless there's a nerve injury, but it'll be uncomfortable. And you won't be as good with it, and you probably couldn't hold something. But,
So if you have suspected that there's a break and you've gone to, say, the emergency, is that the best place to go if you think it's broken?
I think that, again, depends what type of day is and depends what the setup for your local doctor is. If it's, again, if the bones are all in normal alignment and you're suspicious and your normal doctor is, your family GP is set up that he can get x-rays and put on plaster, that's good. Otherwise, there's urgent care centers. And finally, if it's looking real bad, then I would get to one of the local hospitals that deal with pediatrics.
And so, Gary, of the fractures that we've talked about, what's the treatment for them, and then what does recovery look like?
Right. So that is probably worth a full textbook for it. But in general, what most part children can get by with plaster immobilization. They might need a manipulation, then plaster. And then commonly we say in orthopedics everything is 6 weeks. So if a fracture is down by the wrist fractures, especially 6 weeks in plaster. The elbow has to be observed very carefully, because even a mild shift in the common fracture is called a supracondylar fracture. That can lead to abnormal growth moving forward, and sometimes we need to actually put pins in those. And at the elbow, we tend not to immobilize them as long, because we want to get them moving. We don't want to make them stiff, so they're usually immobilized 3 to 4 weeks. But fractures in children can be every bit as bad and spectacular as in adults, so sometimes we need to put rods in them or put plates on. And again, the key thing with all of these is to know, yes, it's huge today, but the child's going to do fine long term. And it's all about taking the view, getting the child out of the moment to long term. Yeah, you're going to be back playing your footy. You're going to be on the basketball court.
How long are they typically in a plaster cast for, if they say have broken their arm or broken their leg?
Yeah, the ones that are near the joint, so being the wrist or the ankle, usually are 6 weekers. If we start getting up the shaft in the forearm or the humerus or in the leg, well, then that can get it out to 10, 12 weeks. It really depends on what the fracture is.
Gary, I feel when we're talking about fractures and broken bones, we're sort of using the terms interchangeably. Is a fracture a break and is a break a fracture?
It is.
Okay, right. I think initially when I heard that my first son had fractured his arm, I thought, that's okay because it's not broken.
Yeah.
But it is the same.
And I will say on that, it's not just you, Frey. I get this all the time, and it's just the lay term is broken fracture.
And now, Gary, stepping sort of to the side of broken bones fractures, can we talk a little bit about overuse injuries? So I know this is something that you see in your practice. Mm-hmm. What might these injuries look like, and how can we support our children through these?
I think that there's no doubt, as one looks back on a career in pediatric orthopedics, there's some things we see less of, and there's some things we see more. And there's no doubt we're seeing so many more overuse injuries. And I think it's easy to get caught up in the enthusiasm the child has for whatever activities they're doing. And of course, our enthusiasm watching them, and we see how the professionals are doing things, and so that's got to be the way. But unfortunately, that isn't the way. They cannot tolerate the loads that a professional, fully grown athlete can do. And so what happens is if they're having too much training or game time, and they get overloading the limb. And the older the child is, the longer they can tolerate. And how you usually notice it is everything seems fine, but let's say after their performance or their game, they're getting a bit of discomfort. Then it goes on a little bit further, and then they say it's hurting when they're playing, but it still look pretty good to you. Then it goes further, and they say they're hurting, and you can see they're hurting. And then finally it goes to the point that it's not just when they're playing, it's hurting all the time. And the key is doling out their activities. The other key is we get so focused on doing one sport. Where we're missing out on is that the children, certainly until probably mid-teens, they should be playing other sports, doing other activities, because each of these sports or activities like gymnastics or ballet can really get the children strong, but in one area. They're not overall strong. And so I do think that a all-round training program is helpful.
What's too much? You mentioned there, we've both got
Very,
very sporty children that love doing every sport under the sun. But, how much sport should they be doing
very,
each
very
week?
difficult. And, sometimes I have the children coming in with stress fractures. I'm horrified at how many hours they're up to. And I thought back, if somebody had tried to tell me not to do that, I would say you're crazy. It's a rough rule, sort of in that 10 to 15. Probably they shouldn't be going over 15 hours of training and competition a week. If you can have them have a day off between activities, that's good. And then, as I said, just be trying to keep their strengthening and their exercise well-rounded. And you can't be dogmatic saying 15, but it should be ringing a little bell in your head that if you're getting up to 18 or 20, just be on the lookout. There's no doubt that there are lots of kids, and we hear about them at the Olympics every year, who had that period where they did do that and they got away with it. But I think that's what it is, I think it's just like robbing banks. You might get away with it, but if you get caught, it's not going to have a good ending.
Can I ask you a little sort of side question to that, Gary? What about something like swimming, where you don't have, the impact of the ground that, to say, a ballerina or a runner or a, different sort of sports people would have? Can that be recovery, or would that count in the 15 hours?
Yeah, I think that's a really good question. And what do we do when we get people that have had stress fractures in the tibia? We rest them, and then we get them in the pool and get them walking, then swimming. So the swimmers at least haven't done that part. But they're still at risk of injuries, especially where the muscle tendon unit inserts into growth plates. It can get problems. But, and it's that, just a repetitive, all they're doing is breaststroke. But that would, again, encourage you to have them doing all strokes. Yeah. And then you're not overloading just that one area.
So, Gary...
and I'll just say another thing, just speaking, moving back from the swimming. Yeah. I think the parents should be aware that certainly in cricket, and then also in baseball, where the bowlers in cricket overload their arm and overload their low back, and in baseball it's their arm. Both those organizations have published really nice charts saying how much is too much for each age group. And I think you hope coaches, but certainly in the end, the parents is the one who's really in charge, and they should avail themselves of those.
That's great, because it's so hard when your child wants to do it all.
They do.
And you're trying to listen to them, you're like, I don't know. Yeah.
And I see, again, probably where the overload comes most in is both in gymnastics and ballet. And when I am definitely the bad cop, when I say about it, backing off and doing this, is universal. The children are really upset. And it's only if it's gotten to that final stage where they're having pain all the time that they'll have some interest. If the parent is proactive and comes in a bit earlier, children don't like it. But in the end, the parent's the parent.
That's right, exactly right. Yeah.
Well, as always, Dr. Gary, that was fantastic.
A huge thanks to Mistela for sponsoring this episode. As much as we want to, we cannot wrap our kids in cotton wool or bubble wrap. With Mistella's Ciccastella SOS Recovery Cream, you can let your kids explore the world. Ciccastella is a multi-purpose cream for little skin boo-boos like scrapes and scratches, insect bites, dribble rash, minor burns or broken skin due to eczema, and it doesn't sting. All of the Mistella products are dermatologist and paediatrician tested. Mistella is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.